All right, I guess we will go ahead and get started. For the record, this session is being recorded for everyone who's online, just as a disclaimer for people who want to view later. So welcome to the panel. This is Healthy School Start Times for Adolescents, a legal and policy public health intervention. My name is Clark Lee, and I am a member at large of the board of directors for Start School Later. So a little bit about me. So for almost 20 years now, actually, I've been studying the issue of sleep health and safety and its impacts on public health and safety. Actually, as a undergrad, as a college student, I was originally pre-med and got involved in a study on long working hours and sleep deprivation in medical doctors. So as a result of that experience, I'm not currently an MD, but I did get very interested in public health and patient safety and legal and policy issues. And so since that time, a lot of my research focus has been on the use of legal and policy interventions to address public health issues, but primarily sleep health and safety. With me today is Terra Snider, Dr. Terra Snider, the co-founder and executive director of Start School Later. I'll hand it over to her for an introduction.
Hi, that was so interesting, Clark. I didn't realize that you were also a pre-med once, as I was. Also never went to medical school, but I did go on to get a PhD in the history of medicine. And it's interesting because my path to this topic also was not direct, but makes a lot of sense in retrospect. It started with grad school in the history of medicine, where I was really interested in the popularization of science and medicine and how science and policy and science and society intersected. And I went on to become a science writer. I was an associate editor at the Journal of the American Medical Association, and I've written a number of books, both for doctors as well as for the public, about number of topics, including sleep, but always trying to bring science into the public view. And so those two things, were my life, other than the fact that I also raised 3 children who started high school at 7:17 in the morning and lived the experience of very early school start times and the impact of sleep insufficiency. On top of that, my husband was twice elected to a school board in Burlington, Vermont, and my 2 daughters served as a student member of school board in a large county in Maryland, which happens to, interestingly, be the only local school board in the country where the student member has full voting rights. And although my husband didn't face this issue, my daughters did face the issue of school start time. So I got to learn about the politics and the school politics of this issue, as well as the health issue. And those 3 things converged into turning me into this advocate. I started a petition about the issue after years of working on my local district and realizing it had to be dealt with in a different way. That led to the foundation of Start School Later, which is a nonprofit that is dedicated to helping districts establish school hours that are compatible with healthy sleep. So that's what we're going to be talking about today. And my kids are long grown. I have 2 grandchildren now. I'm still working at it. This is something people stay with a long time. So I think Clark and I both have a long perspective on this issue, and I'm really looking forward to sharing that with you and talking about your own perceptions of the issue.
And I'm kind of on the opposite end of the parenthood spectrum. So I have a almost 4-year-old and an almost 2-year-old. So the issue of school start times will fairly soon become a pretty pertinent issue in our lives. So originally, joining us was going to be Dr. Amy Wolfson, who's a professor of psychology at Loyola University here in Maryland, but she unfortunately had to pull out. Her presentation was going to focus on introducing and providing some of the scientific background for the benefits of healthy sleep in adolescents and how school start times impact that. So in her stead, both Terra and I will try to tag team a little bit and provide at least a foundation for what we'll be talking about a little later on the advocacy as well as legal side of the issue. But we thought what might be beneficial is to play for you all a little video. Since we, I guess, technically are not subject matter experts on the issue of the science of adolescent sleep, we play a video from a conference, a national conference a couple of years ago that dealt with that very topic. So let me try to share the screen for you. Just stand by. All right.
Fact: experts say teens need 8 to 10 hours of sleep each night. Fact: their circadian rhythms shift about 2 hours later in the day, preventing them from falling asleep before 11 p.m. Fact: 11 p.m. plus 9 hours of sleep equals an 8 a.m. wake time, which for most adolescents is optimal. The math is simple. Middle and high schools that start before 8:30 prevent most adolescents from getting the sleep they need.
Adolescent biology is in conflict with early start times.
If you go to Canada, if you go to Australia, if you go to Britain, you do not see teens having the same degree of sleep problems as you do in the States. And there's a very simple reason for that. They start school later, period.
In April 2017, world experts convened in the nation's capital. The topic:
this whole topic of school start times is not really about school start times, it's about chronic sleep deprivation.
To me, it's a moral issue. Do we have the right to do something that is going to increase the risk of cancer, heart disease, diabetes, obesity on an entire generation of youth? I don't think so.
Things like obesity, car accidents, academic achievement, depression, increased risk of suicide.
Driving on 2 to 3 hours of sleep less than recommended results in a level of driving impairment that by some measures is comparable to driving while intoxicated by alcohol.
When we studied adolescents who were getting 7 hours of sleep a night at 8:30 in the morning, they were down there in that desperate zone of falling asleep.
We now have multiple studies with cause and effect findings showing that short sleep causes teenagers to be mentally slower, less able to learn, especially when they're cramming, less able to juggle multiple bits of information at once.
It's our teenagers themselves that know, are crystal clear, that they know that when they get an inadequate amount of sleep, they're not able to do their best in school.
And we have to stop talking about it as a transportation issue. It is not a transportation issue, it is a student health issue.
In what planet would we do this to our children?
This problem was created by adults and should be solved by adults.
We're moving from asking, should we do it, to how do we do it?
Every obstacle that you run into can be overcome. Their whole motto was, if it's good for kids, we're going to do it.
The fundamental challenge is not the science, it's the politics.
The best politics are when you do the right thing for the right reason.
I'm telling you, if we could do it in Fairfax, anybody can do it. It was one of the most complex systems there is in the country.
Do the later start times work? The answer is yes. We have statistically significant improvement in attendance, reduced tardiness, and grades earned.
It works. Kids came to school happier. We had more parents tell me that I got my kid back.
There is significantly less depression. There's less substance use, and there are fewer car crashes.
The bottom line, it's worth it. It takes courage, it takes determination, and it takes a willpower to say the greater good is the good of the kids.
At the end of the day, to do nothing is to do harm. To do nothing is to do harm. That was just the tip of the iceberg. For the must-see, in-depth presentations on each topic by these leading experts, go to www.schoolstarttimeconference.org.
All right, switching gears. All right. Terra, can you see the slides? Just
Yes.
want to make sure.
Yes.
Right. All right. So just in case you're wondering, here's the URL to that video that we just showed. So just a couple takeaways from that short video. In public health, we often talk about pillars of public health. And of course, I think most of us are familiar with the idea that diet and exercise are important to people's health. But what often gets short shrift, in my opinion, is this issue of sleep as a pillar of public health. Sleep is observed across many species, highly conserved across species, suggesting an important evolutionary function. Now, scientists have been trying to study that for a couple of years, and as far as what the actual function or why it seems to be so important, that is a continuing work in progress in the sleep science field. But what is clear is that everybody needs sleep. I mean, intuitively, all of us understand that we cannot get by with sufficient sleep. The homeostatic sleep drive is probably the most powerful biological drive that is in our bodies. We cannot overcome the drive to sleep. If you stay up long enough, eventually you are going to conk out. And the variety of factors that explain that, which we'll go into in a little bit. But sleep is, the need for sleep and the importance of that changes with age. And I think certainly all of us who've been parents understand that the sleep needs of an infant or a baby are very different from the sleep needs of an adult. Taking that example, that intuitive example to the next level, the same applies to adolescents and teens. The sleep needs of adolescents and teens are not simply little adults, or they're emerging adults, but they're not adults. And so their biological needs can be quite different, and are in fact quite different than adults. Terra, did you want to add anything to that?
No, I mean, all I can say is I obviously agree, and the slide came from me, so I obviously agree. And it is very, very true that amongst the many issues that play into this one is our attitude toward teenagers, as you say. And that isn't brought up a lot, but a lot of people think that teenagers are just kind of dirtier, smellier adults. And it's not true. They're still growing, they're still developing, but we don't tend to think of them as in great need of care as babies and younger children. And that is one of the reasons that this issue, it has become so complex, just one of many. It's absolutely true. The general attitude towards sleep as well is a real problem. Just social norms about sleep that have to do with all of us. And we all suffer from this, I think. It's been largely overlooked.
So we talk about sleep as a pillar of public health. So what do we exactly mean by that, particularly in adolescents? And so this is a compilation slide of a whole bunch of studies from over the years. They're not credited here in the main slide, but they are in the speaker notes. But what's been observed is that deficient sleep in adolescents has been associated with a number of negative health outcomes. And I use the word health broadly in the World Health Organization sense of a state of complete physical, mental, and social well-being, and not just the absence of disease and infirmity. And so you can see, starting in the columns from the left to right, there are cognitive detriments to insufficient sleep or sleep deficiency, academic performance issues, mood issues, behavioral issues, and more broadly speaking, health and safety in a broader physical sense. And when we say deficiency, we're not just talking about the sheer number of hours that adolescents get, but also the quality and the timing of the sleep are important factors contributing to all this. So despite all that, and despite these adverse consequences, what we do know from a long line of epidemiological work is that adolescents in the United States do not get enough sleep. I believe the CDC and other professional organizations recommend at least 9 hours of sleep for adolescents and teenagers. But as you can see from this pie chart, which is a little dated, but I believe the trends still apply, that less than 10% of teenagers in the US are getting this amount of sleep. And this particular data, I believe, comes from the youth, not the BRIFs, but the youth youth, one of these surveillance studies of youth risk behaviors that CDC conducts annually nationwide. And so see that there is an ongoing issue. This was in 2014. The issue of insufficient sleep in teenagers and adolescents was one of the objectives of Healthy People 2020. And as we'll see in a later slide, it has continued to be an issue for Healthy People 2030. Healthy People 2020 and 2030 being the US government's health agenda for the next 10 years. Terra, anything you wanted to add?
I will add something, and that is that, yes, this is from 2014, but when I give talks normally on this topic, and they're not focused on the public policy aspects, but on the sleep and health effects, I have maybe 10 different studies that I bring up because all of them show the same thing. They all define adequate sleep in slightly different ways. They measure it in slightly different ways, but no matter what they do or when the study is, teens are not getting anywhere close to the amount of sleep that they need. That just keeps coming up again and again and again in various ways. So, and I'm happy to share those studies with you too. I don't think anybody really questions it. Some people define adequate sleep as 8 hours, some as 9, some measure it by self-reports, some do it by using actigraphy, which are hand measures of sleep, but whatever they do, very, very few teens are getting enough sleep. And in fact, a large percentage, I think in the CDC studies, I think almost 40% are getting 6 or fewer hours of sleep a night on school nights, which is rather terrifying for all of us when we think that they're out there driving.
So what may account for this, I guess, epidemic of insufficient sleep in adolescents? Previously I mentioned that sleep, the biological drive to sleep is one of the most powerful drivers in our bodies. So certainly the homeostatic sleep drive is one aspect of regulating the sleep-wake cycles. But on top of that, there is the circadian rhythms or internal body clocks that exist in every cell. Which sort of controls the timing of not just sleep, but a whole host of other physiological functions. So if you take a look at this graph, starting sort of at the, I guess the clock positions don't correspond quite well, but sort of looking at the, you wake up sort of at the 7 and 8 o'clock hour, and then if you start moving clockwise, across the noon hours, you can see that there's sort of this period of maximum performance during the mid-afternoon, but then the sun goes down, and then melatonin secretion starts. So melatonin is a male hormone that is very closely associated with the regulation of sleep, and it's very sensitive to lightness and darkness. In this particular graphic, I believe, is focused on your average adult. And so for most adults, the secretion, middle-aged adults, the secretion melatonin begins about 9 o'clock, so a couple hours after the sun goes down. And secretion continues over the course of the night, allowing us, of course, to maintain sleep until the sun rises, and then a couple hours after the sun rises, melatonin secretion starts, and we start a new day. But the story is slightly different with adolescents and teens, in that their circadian rhythms are actually delayed by a couple hours, such that melatonin secretion, which is partially regulated by circadian rhythms, is shifted actually up to 2 to 3 hours later than your normal adult. This graphic is a little bit conservative in saying it's only about 90 minutes, but 2 to 3 hours, I believe, is the standard finding. So what this means is that most adolescents are physiologically or find it challenging to actually fall asleep before 11 o'clock and to wake up before approximately the 9 o'clock hour. This is a physiological or a biological phenomenon. This is not a social phenomenon. But that said, that said, you know, these obviously have certain social ramifications, as we'll discuss in a moment. This next slide just summarizes the main points from the previous slide. I apologize if you hear my phone ringing in the background. I still have a landline at home, but the point is that because of the shift in circadian rhythms and melatonin release, making a teen wake up at 6 a.m. is the equivalent of making a middle-aged adult waking up at 4 a.m. Again, this is developmental and not a cultural phenomenon. Terra, did you want to add anything?
No, I mean, you're right that the shift is usually said to be about 2 to 3 hours. Obviously, there are individual variations. But what's really fascinating about, well, there's two really fascinating things. One is that even people who tend to be what we call larks, who tend to wake up early naturally, as opposed to people who naturally wake up a little later, even if a child tends to be a lark, they will experience this shift. So if your 2-year-old is waking up at 5 a.m., as a teenager, he may wake up at 7 a.m. There's still going to be a shift, and the shift goes away usually in young adulthood, like around the mid-20s. It's not a permanent thing, but that's interesting. And the other thing that I think that's so fascinating about this is that these studies have been replicated in at least 6 mammalian species, and that there is a shift in circadian clock later at puberty. A lot of people think, oh, well, obviously they're just staying up later because they're fooling around on their cell phones or playing video games, but the rodents and the primates studied definitely don't have electronics, and they are still show this shift, which is just really fascinating.
So that being said, so certainly here in this graph, the whole sleep deprivation epidemic in teens, it is multifactorial. So of course we talked about the biological changes here on the right, but as we alluded to, that there are certain solely social factors and other, technological factors, as Terra just alluded to, with cell phones and blue screens, and all of this, for those who are, I guess, more directly public health minded, this should look very familiar. This is essentially an application of the social ecological model of health, which, of course, starting on the left side, you've got the individual level and a number of interpersonal factors, which includes biology, which interestingly in this graphic is omitted, but it includes biological factors such as what we talked about. But we all know that health is also influenced by social factors and environmental factors. So interpersonal relationships, institutional factors, community factors, and public policy, sort of at the most macro level. And by public policy, for the interest of this audience, we're talking about local, state, and national laws and policies. And so, when we're talking about the issue of adolescent sleep and their insufficient sleep, one of the institutional and community factors that certainly impacts this is the issue of school start times. Here I'll turn it over. Let me turn it over to Terra, since I think she is well rehearsed in giving this talking about this slide. So let you have it.
Yeah, I mean there's lots of ways I've seen this displayed, but the bottom line is that we don't know 100% of what time schools are starting, because there's actually no national database of start times. But about 10 years ago, the Department of Education started collecting school start times on a supposedly representative sample of public schools in the country. This is from 2011 to 12. This particular graph, but they do it every few years. I think the most recent one is 2017 to 18. And there aren't really substantial differences. I think the average start time might have moved by one minute later in those 10 years. But they looked at the percentage of schools that were starting at various times and the number that were starting before 8:30 a.m. And basically, in the vast majority of US states, with the exception of, I think, North Dakota and Alaska, more than 75% were starting school before 8:30 a.m. And I think right now about 10% start before 7:30 in the morning. Interestingly, there's one state that does not provide data, that is Maryland. However, we know the start times as there's only 25 districts in the state, so it really isn't that hard to get that information. But the problem is that you can see from this that most US adolescents, and this says public schools, but I think it's middle and high schools. Or if it's all of them, it's even worse because elementary schools tend to start later. But the vast majority of US adolescents are being asked to go to school at a time that is out of sync with their sleep needs. And you remember, if school starts at 7:15, which is very common, or even 8 o'clock, that doesn't mean that a child is getting out of bed at 8 o'clock. It means that they're rising at 5 or 6 a.m. if they're actually going to take a shower, eat breakfast, commute, and get to school on time. And as Clark said before, if they're waking at 5 or 6 a.m., that's like waking an adult at 3 or 4 a.m. And unlike an adult, students have no choice in the matter. They're required by law to get up at these times to go to school.
So, what to do about this particular issue. Again, for those who have had public health training and preventive medicine training, whenever dealing with a population or public health issues, there are often two primary strategies that are used. One is on the right panel here is your so-called a high-risk strategy. That is, you target your interventions at a subgroup within the population that is particularly at high risk of a particular public health problem. Or alternatively, on the left panel, you implement a population-wide or a population-based strategy to sort of shift the curve, if you will, for everyone in the particular population. And when we're talking about adolescent sleep deficiency, one population-based strategy is to delay school start times. As I mentioned, the US government has actually recognized this as a promising intervention and practice. So this is the latest iteration of Healthy People 2030, which includes a series of sleep objectives to improve the nation's health. And among them, and this is only a partial list, but among them are one, to increase the proportion of high school students who get enough sleep, and increase the proportion of secondary schools with a start time of 8:30 a.m. or later. Now, why do we think that this population-based strategy of shifting school start times later works? Well, there have been studies, and I guess I'll turn this over to Terra again, just to sort of recap this particular slide and what she has found in her advocacy experience about the advantages or outcomes of shifting school times later.
Right. I think this study, this 2014 study by Kyla Wallstrom at the University of Minnesota, 2014 was really a pivotal year because this study came out, as did a position statement, which I'll discuss later, by the American Academy of Pediatrics. But this was the first really big study that showed that when schools move their bell times, not only do more teens get more sleep, but as you can see from the bullet points on the left, there were actual measurable health, safety, and learning effects. Now, there had been plenty of studies before that, starting back with another study by Wallstrom in 2002. There had been many other studies before that, but this one was huge. It involved, I think, students in 6 different states. And it was just so large that at that point, it kind of was a no-brainer that this thing actually works. And subsequently there have been more and more studies showing the very same thing. But it was no longer sleep and health are tied together, but actually school start times. Not only the school start times and health are tied together, but when you move bell times later, more teens get more sleep, you get lower rates of depression, you get less use of caffeine and energy drinks, fewer problems with dropping out, fewer problems with discipline,
behaviors.
Fewer mood swings, and really significantly fewer teen car crashes. Again, all this had been shown before in small studies, but this is a huge study. So, and since then, again, we have a very large database. It's not one study that this thing turns on. It's a body of really consistent, diverse, and strong evidence that all say the same thing. But this is definitely one of the pivotal studies here.
So we hopefully just laid the foundation for what we'll be presenting about next. So I will now formally hand over the slide deck to Terra to speak about some of the advocacy and legislative efforts that she's been involved with to try to make school start time policies a reality. So let me stop sharing this.
All right, and now it's my turn to figure out how to share the screen, right? So I got to share the right screen, and let's see if that's working. Are you seeing my slides or are you seeing my grandchildren? Okay.
Yep.
All right, now we're gonna try to do this. Yeah, so I should have worn my Start School Later button, Clark. You just reminded me of that. So advocacy. So this problem is a recognized problem, and I don't know why I'm on the video. I do not want to be. There we go. It's a fixable problem. Many schools have indeed done it. It seems sort of almost like a simple-minded problem. Many schools run at different times all over the country. Why aren't we fixing it? If it's such a big problem, what is stopping us? And that's, of course, where the advocacy comes in. And as I mentioned, if you saw me speaking in that little video, it really, as I was saying, it is not about the science at all. The science is crystal clear. We reviewed the science, and there's no debate. There is a consensus in the scientific community in many different forms. So there's definitely consensus in a diverse group of researchers that this works and it needs to be done. But what the problem is not the science, it's the politics, right? And the politics are a huge issue here, as in many other cases of trying to turn an item where there's scientific consensus into policy. When it comes to school start times, the real issue comes down to the fact that community life revolves around school hours, especially public school hours. And this is true for really the whole community, not just people who have children. It really involves the entire community, partly because so much of any community's population is involved in the schools. Either they are students or teachers or staff, but even for people who aren't, the school hours will affect the times that other things can happen in the community: the after-school education, the after-school sports, the after-school jobs, people who employ students, and of course, traffic. So because the community life revolves around school hours, when you suggest changing them, people get really worried that the schedule that they so finely tuned to these school hours is going to have to change. And there's often a lot of pushback because of that. Kyla Wallstrom has called this issue a political hot potato, and she's exactly right. The reason it's a hot potato, and anyone deeply involved in the issue in education knows this, is that it is something where you could easily lose your position as a school board member or your job as a superintendent by getting into this. So you want to avoid it at all costs. And the history of advocacy reflects that reality. What I'm talking about specifically, people perceive obstacles when hours might be changed. All these issues that I mentioned before are speculated upon. There's no evidence, but people really fear a change. And they assume that they don't think of the school hours and their community life as a holistic system. They think of it as a linear system in which, if they do daycare at 3 o'clock now and school hours change so that kids get out at 4, suddenly their kid won't be able to go to daycare, not realizing that actually the daycare hours will change in lockstep with the school. And that's exactly what we've seen has happened. But these obstacles, whether they're fueled by fear of change and failure of imagination, they are interesting because most of them turn out to be unfounded or overblown or resolvable. That is all true, but they are incredibly powerful politically. they stopped a lot of local communities from making this change. Even a lot of them in the late 90s, early 2000s, school systems were trying to do this internally, but they gave up because they got so much pushback from members of the community. Deb Delisle, who was a superintendent in Ohio and then became an assistant secretary at the US Department of Education, even said that as a superintendent, she said one of the hardest things you can ever do is to begin to tinker with the bell schedule. People go absolutely bananas over that. And this, if you've been involved in this issue, this seems like a no-brainer, but I know when I first got involved, I couldn't believe it was such a big deal to move the time of a school, especially because I had lived in many different states and communities, and I knew schools ran in all different hours. And I knew schools did change hours at the snap of a finger. And I knew that when your kid went to kindergarten and went to middle school and went to high school, the hours changed and your family life had to adapt. Nonetheless, when there was a conscious change made because of this sleep issue, you often have people coming at you with pitchforks. And yet we know many schools have managed to change in spite of these politics. And in fact, the first most prominent ones were in Minnesota. And some of the studies that Clark was telling you about by Kyla Wallstrom were fueled by these early studies. And they were definitely inspired directly by the sleep research we talked about earlier. There's a very prominent movement in Wilton, Connecticut that's often cited, but the truth is that since then, we are aware of approximately 1,000 schools in 70 districts that have made this change. We keep a record as best we can at Start School Later, and there have been so many that there have now been studies looking at, well, what allows them to change? What are the obstacles? What are the best practices? And there's no one size fits all, but one of the things that we have learned is that in all of the communities that make this change successfully, they all simply, it boils down to the fact that they have the political will to change. So that's where the advocacy really comes in, because our goal in advocacy is to build that political will. And to do that, we have found the most effective way to build political will is to reframe the issue as one of public health. And I'll explain a little bit more later about why that works. But in terms of the actual tactics we use, we try to do this reframing at all levels, not just Start School Later, but all the people involved in this effort, ranging from grassroots activism to community education, to position statements by prominent organizations, legislation, and then with the question mark litigation, which has not really been tried, and I think Clark's going to talk about that at the end. And just illustrates it a little more. What's really happening is that there are a diverse set of players working at local, state, and national levels on all of the things I just mentioned. And really, if you know anything about the history of public health or actually of social movements, this is often the way reform happens. A whole lot of different pieces at different levels, different people coming at it from different ways, and eventually the change happens. And what all these different players are doing, and I'm talking about sleep researchers, yeah, oh, that's my landline now, so try to hang it up. All these people are doing is, again, trying to create a climate that allows for healthy school hours. They are trying to build that political will through these various steps, and all of them are trying to frame this as a public health issue, because this is what we see happening. When sleep and school hours are not framed as public health, they're framed as a negotiable school budget item. That is classically what has happened. When they're a negotiable budget item, local school officials basically have to balance school hours against all the other pressing needs that they have to resolve, like paying for instructional materials and paying teacher salaries and benefits. And they often find that it's impossible politically to play those things off each other. But the second that you transform the thinking that sleep and school hours are not negotiable school budget items, they're matters of public health. They're non-negotiable, just like removing asbestos is non-negotiable. Or shall I say vaccines, but in this climate that becomes that is debatable, and I think we're going to talk about that at the end. But any issue that you just assume is a matter of public health suddenly moves the decision into hands other than, say, lay school board members and clarifies priorities. So how is this happening? With us, it's happening, of course, with Start School Later and other advocates through literal advocacy. At the local level, there are many, many chapters in our organization, as well as people who have nothing to do with us who are doing this on their own, who are trying to get their local school boards to change by presenting science to them, by speaking it with the school leaders, as well as testifying at school board meetings, running community events. At the state level, similar things are going on, or regional levels with county councils. And at the national level, for example, if this is our little group talking to, whether it's presenting petitions or joining with other sleep organizations at advocacy days, trying to raise awareness about the issue, as well as encourage policymakers to address it. And this is a student group over here. This is a student group who got change in their community through education and advocacy in a town in Pennsylvania. Another thing that is part of advocacy is encouraging health and education and civic organizations to issue position statements on this. These are very important in instilling credibility to the issue. The most important position statement, I would say, was the 2014 statement of the American Academy of Pediatrics, but there had been statements dating back to 1993 or 1994 when the Minnesota Medical Association, first looking at the research, said high schools need to start later. That's what kicked off the changes in Minnesota, was that position statement from a medical group. And since then, there have actually been hundreds of statements, but the 2014 statement from the American Academy of Pediatrics was pivotal also because they set a specific time. They sort of laid down the gauntlet and said, no school should require middle or high school students to attend before 8:30 a.m. And that was kind of a compromise time, but it was based on political realities and the research at that point. So since then, the AMA has issued a position statement, the National Association of Social Workers, and even the National Education Association, the National Teachers Union group, and the National PTA have issued statements on this matter. We have a list of them all on our website, but this has made a huge difference in swaying and influencing policymakers. And finally, there has been actual legislation on the issue. The first effort was back in 1997 when Zoe Lofgren, Congresswoman from California, introduced what she called and still calls the Z's to A's Act, which at the time would have given funding to any high schools that started at 9 a.m. or later. That act continues to be introduced again and again and again in various forms, generally watered down. I think at this point it might be a resolution, but it continues to be introduced. I think it's still alive. And as far as I know, at this point, there has been legislation about sleep and school start times introduced in 23 US states. And in the ones on this slide with the asterisks, these are states where they've actually passed the legislation. Also, the US Virgin Islands had some legislation, which is actually pretty incredible. This has all been since about 2013. And Clark, I should really give you credit for this dichotomy or this structuring, because I think the first time I heard the bills classified this way was in a talk you gave at the Maryland Sleep Society. But I think you're right. There are three basic types of legislation that have been introduced. And actually all three of them, there's been at least one that has been passed. The first and the most common are study bills, which some people say is a way to get an issue to die. But they basically, allow a state agency or some special commission to research the topic and sometimes to make recommendations. There are incentive bills that reward districts that start at healthy hours or later hours. And then finally, there are mandate bills that generally will establish a statewide minimum standard that all districts have to meet. So those are the three basic types of legislation, and all of the legislation that I've seen fit into these categories. Let me just give you a few examples. This is a typical study bill. This one was out of New Jersey. And it requires the State Department of Education to conduct a study on options and benefits of instituting later school start times in middle and high school. Some people, of course, said this was, as I said, or alluded to, is just a token measure. But the truth is that New Jersey went on to pass a pilot program bill. So it did lead to more action. We still don't know where that pilot program is going, but it did actually make some form of a difference. And there are lots of forms of these study bills. The incentive bill, this was the only one I know that has passed so far. I was really involved with this. I have to say it has not been much of a success, but we call it the Orange Ribbon Bill, and it also followed a study bill. And what it is supposed to do is reward with non-financial, just a certificate, simply reward districts that move toward later start times or have later start times. It has not been well utilized, but it did pass and it helped bring awareness to the issue. A better incentive is one that I wrote about in a paper on behavioral economics. I haven't seen anyone do it, but I'm waiting for somebody to introduce this legislation. And that is to simply require districts that don't move to healthy hours to file extensive paperwork every year, relying on what the behavioral economists call the default option, making it much more work to start school early than to start school late. So that's another way an incentive program might work, but this is the only one that has passed so far. And of course, the most prominent and exciting bill was the one passed in California in 2019, which mandates that no high school start before 8:30 and no public middle school start before 8 a.m. There are some exceptions. I'm happy to discuss the details of this bill later if you have questions. It was the result of a lot of advocacy on all the levels that I discussed earlier, because it really took the network of people who had been educating and advocating for years across the nation to get this bill to happen. And it was passed and then vetoed by Jerry Brown. And then the next year passed again and signed into law by Gavin Newsom. And it is supposed to take effect everywhere by 2022 to 23, or when teachers' contracts next expire, with a few exceptions. And of course, the pandemic kind of interrupted the process, but it's still in play. And excitingly, there's another bill right now that's probably even stronger than this one, but we'll see where it goes. New York State now has a bill that has just been introduced that would mandate that no schools start before 8:30 a.m. period. And it's also an incentive bill, because schools that start any earlier will not receive state funding. So I don't know where that will go. The truth is that most mandate bills never make it out of committee. That's why the California bill is so much of a landmark piece of legislation. It just went far beyond anything we've seen before, and it's inspiring similar legislation around the country. There have been a number of similar bills introduced subsequently. So I'm going to stop talking at this point and let Clark address the litigation side of this. And if I can figure out how to close out my screen, I might need some help shutting down my shared screen.
You see us? Yep, you're out. Okay.
Okay. Yay.
Yep. Let me reshare my. Can you see it?
Yep.
All right. So since this is the Public Health Law Conference, and we have talked quite a bit about public health and legislation, figured it was time to talk a little bit about the law. So well, first, a couple disclaimers. First off, anything that I'm about to present should not be construed as legal advice in any way, and the opinions and analyses expressed are my own and do not necessarily represent official views or positions of Start School Later. So we've been talking about so this social ecological model again, is sort of framing the discussion that we were having on the school start times issue, that it's an example of a institutional and community as well as a public policy intervention to address the problem of insufficient adolescent sleep. Terra just went through a bunch of legislative efforts, but included in this public policy there is the current or existing legal landscape or framework that may inform the issue. This slide, this is, I guess, Public Health Law 101, Scott Burris's slide from 10 years ago. It's talking about public health law research, but I think this neatly illustrates how legal interventions are supposed to work in impacting public or population health. So of course you have the lawmaking process, which Terra discussed some of the efforts she's been involved with, that produces laws which then govern or regulate legal practices, which on the one hand may be targeted at individual changes in behavior or changes in the environment. So going back again to this last slide, which then produces outcomes that promote and improve population health. We also talk about public policy interventions and how they may differ or how they relate to legal interventions or law interventions. And so the way I often think of it is that policy interventions are operationalized by legal interventions or laws, which are then implemented and evaluated based once again on policy interventions or public policy. So it sort of forms a cycle. It's not really linear as this figure sort of suggests, but it's a continuing cycle. And so that is why, sort of having an understanding of current legal landscapes is important, how it may impact some legislative or advocacy efforts. So I'm going to just spend a couple minutes talking about sort of the legal responsibilities of different stakeholders. And I'm going to be focusing on public education simply because, and then that's not to say that private education or private schools aren't impacted by this, but when we talk about the legal landscape as a population health measure, most often these are targeted at public education and public schools. So, and in particular, I want to talk about some legal responsibilities of public education when it comes to student education and welfare. So this goes again to the WHO definition of health being a state of physical, mental, and social well-being, or we'll use the term welfare here. So one of the questions we actually got from an audience member was whether or not there was a federal solution to the school start times issue, since it seems pretty universal. So the issue there, and this has been a long-going debate, is that under the American constitutional structure or principles of federalism, federal government traditionally has a very limited role when it comes to education. And that certainly was the case right through the mid-20th century when we entered the civil rights era, and then the federal involvement in education when it comes to protecting civil rights of students and matters related to special ed came to play. But by and large, the issue of public education and when it comes to student welfare has largely been left to the states and localities. So here we've got at the state level, states traditionally set standards across all the school districts in the state. This involves law and policy making, which could include legislation or law, passing statutes or promulgating regulations that may be related to student health, safety, and welfare. But the king in the current public education infrastructure, if you will, is still local school boards and superintendents, the mantra of local control being sacrosanct when it comes to public education. So they still maintain a dominant role in public education and policymaking, and this is often controlled by elected school board members, local school board members, and appointed superintendents. And of course, most recently, we have seen, issue of mask mandates and vaccinations in public schools arise at the local school board level or at the local level. I mean, we have certainly just tuned into the news and we have seen what's unfolding there. More on that a little bit later. So despite the power of local school districts or local school boards and superintendents, the individual school administrators and teachers, so principals and teachers, still do have quite a bit of discretion in some areas. So for one, the policies that are passed by the local boards and superintendents are often left to the teachers and administrators to actually implement at the institutional level or at the school level. But they do maintain significant discretion when it comes not just to implementation, but on other issues such as student discipline and teacher evaluations, I think is another big area. And then, of course, there is the role of the parents in all this. Certainly, for those of you who have school-age children, you do appreciate that you're legally authorized to make certain important decisions about your kids' education. And in some cases, it's the parents that need to assert the legal rights on behalf of their children in the education domain. And this, especially, just thinking of special education rights, is what immediately comes to the fore. But so parents and guardians certainly have a role in a legal role in protecting and promoting student education and welfare. But want to go back to the school and local school board levels and talking specifically about some established legal responsibilities that public health schools have regarding student welfare. So by and large, there is a common law or statutory duty in most states to supervise students at schools and to protect them from foreseeable harms. And this is based on the compulsory nature of education. That is because students are required to be at school by law. Schools essentially become custodians of the students while they're required to attend in school. So in loco parentis, this creates a special relationship duty to provide reasonable standards of care to the students. Now, what a reasonable standard of care may be, courts have interpreted that differently state to state, but it could include the duty to warn to known risks and dangers and to provide a safe environment for students. On top of this common law or statutory duty, there may be specific duties under state or local laws and ordinances to promote and protect student welfare, such as those regulating conditions in school facilities, anti-bullying or harassment measures to create improved school environments. But it's also important to remember that public schools or schools in general are not absolute insurers of student welfare. And that comes in that becomes important when we talk about the next issue. So Terra alluded to or mentioned about the role of possible role of litigation, and oftentimes I've been asked, so given all of these legal responsibilities and apparent duties that public schools have, why don't we sue to make it happen? Now, another disclaimer. So I am not a litigator, so this conversation is going to be somewhat academic. I'm sure if for the litigators in the audience, when it comes time to Q&As, we certainly welcome feedback if you sense something inaccurate with what I'm about to say. But here I go anyways. So there are a number of strategic, and just like with any suits, there are a number of strategic considerations if you want to go the litigation route for making the later school start times issue happen. And the first is, of course, what is the legal basis or theory of the suit? So what are you claiming? What either laws or constitutional rights might be violated? Are we talking about federal constitutional principles of life, liberty, or not life, liberty, but of life and interests? Or are we talking about statutory rights at the state and local level? Are we talking about discrimination issues? What is the theory behind them? Are we talking about negligence? Then the question is, well, who are the plaintiffs? So who can actually sue to make this happen? Who has the standing? And is this a one-off private action, or is this can you get a group of plaintiffs to form a class and pursue it as a class action? What are the remedies that you're going to seek? So sure, you're going to sue. So what are you going to ask for? Are you going to ask for school districts to push back school start times for everybody? Or are we going to limit that and ask them to implement later school start times for only certain students. Then, in the matter of strategy, there are a whole bunch of procedural challenges that you have to address or get over. First is the non-justiciability issue. So that is that in order to proceed with the lawsuit, you need to meet certain threshold issues. That is, you need to find a plaintiff who has standing or a legal right to actually move forward with a claim. There's the rightness issues. That is, have sufficient facts been developed for there to be a matter to be even adjudicated. And then there's the political question doctrine. Courts do not like to enter into, or traditionally they have not liked to enter into the political fray. So if they deem a issue to be a political question rather than a legal question, they will want to defer to the legislative body, since they figure that those are legislative and executive branches of government, since they are best suited to address political questions. Other procedural issues, and this is common not just to this issue, but to any litigation, is a failure to state a claim. That is, there is no legal claim that relief can be granted on. So dismiss the case without even going into the merits. Then on top of that, you have to get over the hurdle of substantive defendants that the school districts could raise. So there are affirmative defenses. So that is, these are defenses that the defendant can raise that even if you, the plaintiff, are able to demonstrate all the elements of your claim, the defendants can raise an issue that undermines the plaintiff's ability to win. And so I guess in a negligence contest, if a plaintiff sues for negligence, contributory negligence would be an example of an affirmative defense. That is, the plaintiffs themselves contributed to the situation that or the injury that they're suing over, and as a result, they should not be entitled to full recovery, or in the case of Maryland, full recovery at all. There are also the issue of, if you talk about public schools, immunity-based defenses. That is, can school districts raise the issue of official immunity to fend off particularly tort-based suits, or the issue of qualified immunity? Can individual school officials fend off individual liability so long as they did not violate a constitutional or statutory right of the individual students? And then, of course, there are counter arguments that can be used to undermine a claim. So in the case of negligence, they can, one, argue that schools had no legal duty to implement school start times, or alternatively, there is an insufficient nexus or causal nexus between the school start time policies of a district and the injury that a student suffered. So there are a whole bunch of hurdles with and challenges with the litigation route, which makes it very challenging when it comes to this sort of advocacy, and which is why perhaps the sort of legislative route or the advocacy route, dealing with local school boards or state legislatures, may be the more efficient way for going about things. That is not to say that these sort of litigious arguments don't have a role in advocacy. And so here I have a part of a table from a paper that I published a couple years ago on using law-based arguments to vote later school start times, time policies. I know it may be a little hard to see, but there are a couple of strategies or a couple of ways that law type arguments could be used for advocacy. And I think Terra actually mentioned a couple of these. One is you could use the argument, you can emphasize that the school start times issue is consistent with existing child welfare laws and policies in your community. Or even at the federal level. So you think of there are child labor laws that restrict the hours that teenagers can work, and you contrast that with the early school start times or hours that public schools have. There seems to be an inconsistency when it comes to the legal landscape of child welfare in a jurisdiction. You could also use the school start times arguments or law-based arguments to emphasize consistency with existing legal responsibilities. So we mentioned a couple of those, the whole in loco parentis. And you could also use these law-based arguments to emphasize or reinforce that this would be consistent with existing societal values and norms in your community. That is to say, we all love our children, we all care about their health and safety. And so, this school start times issue is just another example of protecting, that particular societal or community norm. And so that's sort of a non-litigation way of using law-based art or using current legal landscapes to promote the school start times issue. There's a couple references, and so this point I think we can turn it over to Q&As. So I'll admit, and you probably have noticed that a lot of what we've been talking about, this presentation essentially could have been crafted in many ways was crafted before the COVID-19 era. And as we have seen, when we talk about advocating for child and student health and safety, COVID-19 may I don't know if it's necessarily changed things, but we've definitely seen the issue of child welfare in communities and measures intended to promote and protect children's health in the schools come to the fore. So one of the issues, and I guess I'll pose this to Terra, is how do you think COVID-19 and all that has happened since may have impacted or affected future school start time advocacy efforts? Terra?
Such a good question. Why don't you stop sharing your screen?
Oh, yes.
Yeah.
Hold on.
We only have a few minutes. No, it's a really good question, and we can't pass judgment on it completely at this point. I am a historian by training, and I know that when you're in the midst of a phenomenon, you can't always judge it accurately. But one of the things that we've observed in passing anyway is that there has definitely been some strong evidence, just affirmative evidence, that when students are allowed to kind of have free reign, as they did during the virtual schooling and online schooling and hybrid schooling, there was more evidence that they were, A, they had been terribly sleep deprived, and B, they were getting a lot more sleep when they didn't have to be in class at 7 in the morning, because we did surveys, and we and many other people did studies showing that virtually nobody was starting this early on this during the pandemic. And the result of that is that a lot of districts have used this as an opportunity to make a change that they said they couldn't make before. They have actually found that they were a lot more flexible than they thought they were. That is something the pandemic has shown communities and school systems, that things didn't have to be the way they've always been. Not that they've always been exactly the way they were in 2019. That's a whole other story. But they realized they could make abrupt and significant changes overnight. And so in that sense, it's accelerated the movement. On the other hand, it's certainly been a distraction, and it's led to certain debates about local versus state control of schools that you alluded to before when you mentioned the masks and the vaccines, where a number of districts are saying, I don't care if it's public health, it's our opinion that matters. So we can do what we want against the judgment of, say, the CDC or the state Department of Health. But in general, we've seen a movement toward more schools making the change, and an understanding that, boy, teens really do better when they don't have to get up at 5 in the morning. I think there's a couple questions or comments in the chat. I don't know if you can see them, Claire.
Yes, so we addressed one. All right, so do you think any existing or future research showing better academic performance with later school start times will move some school districts? School districts have been known to be competitive.
Yeah, I can answer that. I think that if such evidence ever existed, it would help, but I don't think it necessarily is going to exist, because academics in particular, I'm talking about grades and test scores in particular, are inherently subjective. It's hard to compare one district to the next. It is true that in terms of when I talked about lay school board members making this decision, they are motivated by things different than, say, the Department of Health or the legislature or the community. They're motivated by things like, we have to get the grades up and we have to pay the teachers. And yes, if we could prove that, it would probably help. What might help, though, is more evidence that there are improvements in, say, graduation rates, suspensions, disciplinary actions, anything that, I mean, basically it comes down to motivation. If they're motivated to make the change, if they benefit from it, they will do it. There is actually a lot of evidence about those things. But yeah, we've got a paper in press right now that we're hoping will make some of these points about what would help districts make the change, and more evidence about things that motivate local decision makers would definitely help. I just don't think we're going to see it in the grades and test scores, honestly, especially because, remember, in many districts, you won't see much of a change in grades and test scores if the students are already doing very well. What you'll see is that their mental health and their emotional and social adjustment will be affected, and their physical health will be affected, but it is very possible to do very well in school and be very sick. And that's not the business of a local school board, really.
I'm not seeing any other questions in the chat box.
I think we've only got 2 minutes left.
2 minutes. Any closing comments, Terra? Any takeaways for this group of public health law advocates and experts?
Only that I'm very happy that this topic is being discussed in this context, because it is definitely an issue that I don't think has really come up a lot in this community. And I know some of you, at least from what I was seeing amongst the registrants, may be facing it in your communities, your states, with some of the laws. And I'm happy to answer any questions or address any concerns offline. I think you have a way to reach us, or look at our website, startschoollater.net, because we try to provide a lot of information as well as access to people who are doing work in this area. It's a very complicated issue. It seems very simple on the surface, but it's incredibly complex. And you know, I think it is a public health issue, and I'm just delighted that you're thinking about it. Clark, do you have anything to add?
No, I just want to thank the meeting organizers for allowing us to present on this issue. I mean, the motivation was, I did notice that, you know, in public health law circles, this topic hasn't really emerged, and I thought it was right to at least put it in a way, having this in a virtual conference that is recorded. I think, you know, that this will be a good way to get that message out to this community. So we are right at 5:15 Eastern on the dot. So I want to thank all the participants for attending, and for future viewers for watching, and have a good evening. Enjoy the rest of the conference.